Context and objectives for Module 9. Continued context and objectives.
Hypovolemic shock. Hypovolemic shock is an emergency condition in which severe blood and fluid loss make the heart unable to pump enough blood to the body. This type of shock can cause many organs to stop working. The loss of body fluids can cause a decrease in blood volume. Ways this can happen is through excessive diarrhea, excessive sweating, severe burns, protracted and excessive vomiting. Blood loss can be to bleeding from cuts or wounds, injuries, internal bleeding. Some of the symptoms are cyanosis of the lips and fingernails, anxiety, chest pains, rapid heart rate, shallow breathing, low urine output. The greater and more rapid the blood loss, the more severe the symptoms of shock.
The stages of shock. Initial stage is the baseline map is decreased by less than 10 millimeters of mercury. The signs and symptoms, not a lot of symptoms to detect. You may see increased heart rate and respirations. Rate is increased in diastolic pressure. The non-progressive stage is when the MAP decreases by 10 to 15 below patient's baseline. The signs and symptoms are thirst, anxiety, restlessness, tachycardia, tachypnea, decreased urine output, falling systolic blood pressure, narrowing pulse pressure, cool extremities, and 2 to 5% O2 sats decrease.
Hypovolemic shock, some of the labs that you're going to see is your pH will be decreased, your PaO2 is decreased, your PaCO2 is elevated, your lactic acid is elevated, your H&H is elevated in states of shifts or fluid shifts or dehydration, and decrease if it's due to hemorrhage, and your potassium is elevated. Some of the treatments for hypovolemic shock is oxygen, a blood transfusion, fluid replacement. Vasoconstrictors will improve your MAP by increasing the peripheral resistance, as well as inotropic agents. They directly stimulate beta adrenergic receptors on the heart muscle, improving the contractility. And agents enhancing myocardial perfusion. They improve the myocardial perfusion by dilating coronary arteries rapidly for a short time.
Septic shock. Septic shock is sepsis-induced hypotension persisting despite adequate fluid resuscitation. It is a stage of sepsis and SIRS with multiple organ dysfunction syndrome, or organ failure and poor clotting with uncontrolled bleeding. Septic shock is a complex type of disrupted shock that usually begins as a bacterial or fungal infection and progresses to a critical emergency. Sepsis steps. So these are the criteria. SIRS is elevated temperature or decreased temperature of 96.8 Fahrenheit. Respiration rates are elevated. Heart rate is over 90. WBC is 12,000 or under 4,000. 10% bands or more. The PCO2 is
less than 32. Sepsis requirement if they meet 2 of the SIRS, plus confirmed or suspected infection. Typically in hospitals, they will call a code team there so they can start the SIRS criteria, such as drawing the blood cultures. In severe sepsis, you see positive sepsis, signs of end organ damage, hypotension, and your lactate is greater than 4. In septic shock, you have severe sepsis that's persistent. You have signs of end of organ damage, hypotension, and your lactate is elevated.
Conditions predisposing to sepsis and septic shock. Malnutrition, immunosuppression, large open wounds, GI ischemia, exposure to invasive procedures, cancer, older than 80 years old, infection with resistant microorganisms, receiving cancer chemotherapy,
alcoholism,
and diabetes, chronic kidney disease, transplantation recipient, hepatitis, HIV, or AIDS.
Who is most at risk? Patients that are immunocompromised and those who have central lines. Central lines are a direct access point for microorganisms and can lead to central line associated bloodstream infection. The guidelines for prevention of the central line bloodstream infection target 4 potential sources of contamination and subsequent bloodstream infection. So skin organisms, contaminated catheter or catheter hub, contaminated infusate, and hematogenous spread.
Physical assessment and clinical manifestations. Cardiovascular changes. So you'll see a cardiac output and blood pressure. They will be low in early sepsis and very low in septic shock. Poor clotting also occurs, increasing risk for hemorrhaging. Respiratory. The lungs are susceptible to damage and the complication of ARDS. You also see skin changes, kidney, urinary changes, psychosocial changes, and labs. Especially the lactate level will be increased.
Bundles for resuscitation and management of severe sepsis or septic shock. Within the first 3 hours of suspecting severe sepsis, you want to measure the serum lactate levels. You want to obtain blood cultures before administering antibiotics. You want to administer broad-spectrum antibiotics. If either hypotension or serum lactate levels are elevated, administer 30 milliliters per kilogram crystalloids IV. Measure the glucose levels. Within 6 hours of initial manifestation, you want to prescribe vasopressors for hypotension. You want to measure the central venous pressure, measure the oxygen saturations, and you want to remeasure the lactic acid levels if initial value was elevated.
Question. Within the first 3 hours of suspected severe sepsis, the patient's serum lactate level is greater than 5. Which of the following will the nurse prepare to administer? A. 30 milliliters per kilogram of crystalloids IV. B. Insulin therapy. C. 3 milliliters of crystalloids IV push. D. No therapy is needed. Document and continue to monitor. The answer is A. Second question. Clinically, SIRS is identified by which of the following symptoms? Select all that apply. A. Temperatures greater than 100.4 Fahrenheit or lower than 96.8 Fahrenheit? Yes. Respirations rate greater than 20? Yes. C. Heart rate lower than 60? No. D. WBCs greater than 12,000 or lower than 4,000? Yes. E. PCO2 greater than 32? Yes.
Cardiogenic and neurogenic shock. Cardiogenic shock. It is when systolic or diastolic dysfunction, compromised cardiac output, results from pump failure, secondary intrinsic heart muscle damage. Precipitating causes, MIs, cardiomyopathy, blunt cardiac injury, severe systemic or pulmonary hypertension, cardiac tamponade, myocardial depression from metabolic problems. Some of the signs and symptoms you'll see is tachycardia, hypotension, narrowed pulse pressure, elevated myocardial O2 consumption, tachypnea, pulmonary congestion, pallor, cool, clammy skin, decreased cap refill time, anxiety. Here is a chart of the pathophysiology of cardiogenic shock.
Neurogenic shock, what is it? A hemodynamic phenomenon that can occur within 24 hours of spinal cord injury at the 5th thoracic vertebrae or above and can last up to 6 weeks. It results from disruption in the communication pathways between upper and lower motor neurons. Improper administration of anesthesia to the spinal cord or a car accident or sports injury to the spinal cord. Medication affects the autonomic nervous system that regulates breathing. Some manifestations you will see are severe hypertension, bradycardia, temperature dysregulation resulting in heat loss, or dry skin. This is the pathophysiology of neurogenic shock.
The treatment for cardiogenic shock would be to restore blood flow to the myocardium by restoring the balance between O2 supply and demand, thrombolytic therapy, angioplasty with stenting, emergency revascularization and valve replacement, hemodynamic monitoring, diuretics, and circulatory assist devices.
For neurogenic shock, you would stabilize the spinal cord injury. Airway is important. Treatment of hypotension and bradycardia with vasopressors and atropine. Fluids used cautiously as hypotension is generally not related to fluid loss, and monitor for hypothermia.
Anaphylactic shock. What is anaphylactic shock? It's a form of distributive shock, an allergic type 1 hypertensive reaction. It occurs due to B cells alerting mast cells, the basophils alerting white blood cell, causing release of histamines, therefore sensitizing the patients. Histamine is a potent vasodilator, causing decreased BP, oxygen, and tissue perfusion. Histamine causes leaky vessels, therefore swelling. Below are the types of anaphylactic shock. You have AKA anaphylactic IgE response has sensitizing of patients. That's the immunologic. Non-immunologic, AKA anaphylactoid, does not have an IgG response. Hence, patient does not need to be sensitized. It's caused by direct cell. e.g. of meds that cause NSAIDs, IV meds. For the assessment, your ABCs are the priority. You want to monitor for respiratory failure, cardiac arrest, angioedema, swelling of the lips, the tongue, increased heart rate, decreased BP, decreased O2, wheezing, facial flushing, bronchospasms, bronchoconstrictions, nausea, vomiting, diarrhea, loss of consciousness.
Treatment, you have to act fast. Allergens and to remove, and airway. Call rapid response. Trendelenburg and raise patient's feet. First line of drug is epinephrine, IM sub-Q. Administer IV fluids. Stay and monitor with the patient. And teach how to administer, hold for 3 seconds, and massage for 10 seconds. Call 911.
Alternate immunity, RSV versus SARS. RSV is a respiratory virus that infects the lungs and breathing passages. The people most likely to contract it are premature infants, young children who have heart or lung disease, children with weakened immune systems, older adults, people who are immunodeficient. Outbreaks tend to occur in the fall to end of spring. It can easily enter through the nose, ears, or mouth. It spreads easily through the air, through respiratory droplets. Diagnostics would be a nasal swab that can be tested for indications of the virus in saliva or other secretions, and a chest x-ray.
Yes, common symptoms appear 4 to 6 days after exposure. You'll be congested, running, dry cough, low-grade fever, sore throat, headache. Some severe symptoms would be pneumonia, fever, severe cough, wheezing, rapid breathing, cyanosis. RSV leads to bronchiolitis. The treatments for RSV is Tylenol to reduce fever, antibiotics, and humidified O2. Preventative care, there is no vaccine for RSV. You wash your hands frequently, avoid exposure, and you keep countertops clean. And Cynagus is a medication that is used to help prevent or any patient that is at risk of RSV.
SARS is a rapid spreading infectious disease caused by the coronavirus. Elderly, especially those with conditions such as diabetes or hepatitis, receive it. Symptoms would be pneumonia, fever, nausea, vomiting, respiratory distress. It can lead to respiratory failure. The following slide shows the transmissions and the treatments for SARS and the prevention.
The answer is D.
Below are the references.